Hello, welcome to your favorite channel, Little Angel's Corner. My name is Dr. Stella. Have you noticed recently that your baby is drooling excess saliva and that the baby seems to put every object into his mouth? Well, it may just be that your baby is teething. So today, I'm going to be discussing with you what to expect when your little one is teething. To start with, what is teething? Teething is a period in a baby's life when the teeth start to erupt through the gum. Usually, it starts with the lower gums and eventually the upper gum too is involved. So, what age do our babies start to teeth? It's usually from 3 months or 4 months to 7 months. But you know, each baby is unique. All babies do not develop their milestones within the same time frame. So if your baby's zone is delayed till 1 year, it's still okay. It's still healthy for the baby. So what are the symptoms that you are likely to see if your baby is teething? Well, I'm sure you've noticed your baby will be crying more regularly, incessantly than before. Your baby may be restless. Your baby may also be grabbing on anything and using it to scrub his gum, to rub the lower gum. And also, you'll notice that baby is drooling a lot of saliva. All these are signs that baby is about to produce his first tooth. So do not be worried. It is a physiologic process. It is normal. It's nature at work. So when baby is manifesting all these symptoms, what do you do to comfort baby? Like I've told you, it's a natural process. So the best you can do for baby is to try to alleviate these symptoms as much as possible. So you could help baby by ensuring, then it's good to mention at this point that some babies present with a low-grade fever. When I say low-grade, the body is just warm. The temperature is just warm, below what one would expect if a baby actually has a fever. The temperature would be below 37.4 degrees centigrade. That's a low-grade fever. And then, what do you do to alleviate baby's symptoms? You do well to give baby antipyretics or analgesics. That will help to soothe the baby. And then you'd also do well to assist baby to rub that gum. Because the gum is actually inflamed. You see the area is swollen, it's reddish, and baby would be rubbing that area frequently. So make sure you wash your hands properly under clean running water with soap. Wash with soap. And then just gently massage that area that is swollen in the baby's gum. Massage it just slowly and gently. Do not be harsh with it so that baby will not bleed. And don't be scared to put your finger, use the index finger. Don't be scared to put your finger into baby's mouth because after all, baby doesn't have any tooth yet. So baby is not going to bite you. As you rub and soothe baby, you'll see that baby will calm down and may probably sleep off. Also, what you could do to assist baby, most of the time during this period, they like to latch onto the breast and breastfeed. allow the baby to do so. For those babies that are being bottle fed, you can also go ahead and give them their baby milk through the bottles, feeding bottles. However, don't be tempted to overfeed baby so that baby will not start to vomit. And then it's also good for us to remember, like I said, it's a physiologic process. So usually when the first tooth comes out, it's usually the lower one. We call it the incisors. Once it erupts, you just see a whitish hard substance, a whitish hard tissue. Once it comes out, these symptoms tend to be abated. And usually this takes about a few days, 3 to 4 days, 5 days, hardly up to a week, and baby is fine. So don't be tempted to give baby certain things, which I'm going to mention now, because some friends, mothers will tell you, um, um, give, put toys into the baby's mouth to assist to rub. That is this, we call it teething toys. It's a no-no because we seem to forget that these same toys may drop on the floor, and then one is tempted to put it straight back into the baby's mouth without washing, and then all the germs that is on the toy enters the baby's mouth and causes more problems. So it's better to leave out teething toys. And then some friends may also advise you use warm cloths, use cloths to try, and they'll even say, or cold ones. They'll tell you use cold um, towels, flannels to rub the baby around that area where the first tooth is about to erupt. No, don't put anything. It's a physiologic process. By introducing any foreign object into the mouth, you're just going to compound baby's problems because you're introducing germs. Finally, some schools of thought, some friends may also tell you use teething powder, teething gel, teething herbs in different forms. But it's a no no. It's a no no. It's better you just allow this physiologic process to go through its course and alleviate baby's discomfort by giving analgesics and using your own clean finger, index finger, to massage. Because those teething medications contain other ingredients aside from a bit of antipyretic, just a little bit of antipyretic, which is the key medication that the baby needs. These teething medications just have a little of antipyretic and a lot of other ingredients that may even be harmful to the baby. So it's better to leave those medications out. Then finally, it's good to point out at this point that if baby continues to be irritable, continues to cry, continues to fret, and starts to have diarrhea, or is starting to tug at his ear, starts to run a high grade fever, 37.5 degrees centigrade and above, then it may not just be normal teething. There might be some other underlying condition. At this point, it will be good to take baby to see his doctor and seek medical opinion so that if there's any other underlying problem, it is discovered on time and baby is appropriately treated. Um, I have tried as much as possible to bring out the salient points which you'd expect in a baby that is teething. It is a physiologic process. It will wane and eventually, over some days, and eventually disappear once that tooth erupts. So if you have enjoyed this video, please share, click the like button and subscribe so that other mothers can also get this information, and together we will grow a community of healthy babies. If you also have any questions or any comments, please drop it in the comment section. I'll be sure to give you the response. Thank you. See you in my next video. Bye.